The Senate has instructed its Committee on Health to investigate the circulation and sale of 42 anti-malaria drugs banned by the European Union. A federal lawmaker, Senator Theodore Orji, raised an alarm that the 42 malaria drugs, which were already banned by the European Union, are sold in Nigeria, despite the organization banning the drugs because they are considered to be dangerous and linked to kidney failure. He said EU countries have banned malaria drugs which contain plasminogen, artequin, coarinate, arco, artacon, and dalquin. He also added that he is worried that NAFDAC and the Standard Organization of Nigeria, SON, have not addressed the issue.
Alarm that all the 42 anti-malaria drugs banned in Europe are still being stockpiled and sold and consumed in Nigeria. Concern also are the enormity of the danger the continued sale and consumption of these drugs can pose to the health of Nigerians. Senate observes that the situation is already trending and generating panic and concern among medical practitioners and members of the public.
The chairman of the Senate Committee on Health said in his experience as a medical doctor, some of these drugs are used as a combination therapy to fight malaria.
There is a conflict between the European Union and the World Health Organization. WHO approves combination drugs for use in Africa. WHO partners with African countries to do research on our problems. European Union, they do their research in Europe because they don't even have malaria in the first place. If any Nigerian has malaria in Europe, they quarantine the person because they are not used to treating frequent malaria issues. But the most important message we should get out of this particular motion is that we need to strengthen our Nigerian Medical Research Institute, because we have the Nigerians here to actually research on, to know what works for us in Nigeria. The Medical Research Institute, every year, they are not funded. So there's no way they can do all this research. And we keep on relying, we have surrendered to the European Union, we have surrendered to WHO to tell us what will work for our people.
Meanwhile, Speaker of the House of Representatives Yakubu Dogara says the lower chamber intends to conclude work on the proposed amendment to the 1999 Constitution by Thursday, 27th July 2017. The Speaker made the remarks after the chairman of the ad hoc committee on the review of the Constitution, Representative Lassun Yusuf, submitted the committee's report to the House. The Speaker informed members that they will be expected to vote on the recommendations of the committee.
It's important for honorable colleagues to be here. The important thing is that if we form quorum, once we get 2/3, the requirement is not 2/3 of the entire membership, but it is better for us to get 2/3 of the entire membership so that whatever we do will not be challenged in court or subjected to litigation.
Meanwhile, the report of the Constitution Amendment has also been laid before the Senate. The debate on the report is expected to begin next week. The Senate President has expressed his commitment to collaborating with the National Commission for Refugees, Migrants and Internally Displaced Persons to ensure effective coordination of intervention efforts towards protection and rehabilitation of migrants and IDPs in the country. The Senate President made the remark when the Federal Commissioner for Refugees, Migrants and Internally Displaced Persons led other management staff of the agency on a visit to him in the National Assembly. He says the Senate will look to see how it can help strengthen the organization's capacity to provide humanitarian relief and administer livelihood programs.
There is need for us to collaborate and work with our development partners, particularly the EU, who also see this as a big problem. And a lot of them are ready to work out a win-win situation where we can address and give support to us on what happens to the migrants when they come back to the country. And I think collaboration with a lot of the countries to see what kind of package can be put together for those who are being asked to come back to Nigeria. What can we do to enable them to settle as quick as possible into the community.
We are committed to keying into the recovery plans of the Northeast as envisioned by His Excellency President Muhammad Buhari by upholding to the core humanitarian principles of alleviating the sufferings of our persons of concerns while promoting their dignity and well-being. Your Excellency, our work is enormous, challenging, and we realize that we cannot do it alone. And that calls for the need to reach out to those who are widely known for their empathy and support to the plight of the vulnerable persons in Nigeria.